Hi, welcome back to our channel. In today's video, we want to discuss on a topic which all of us deal with in our day-to-day life. Have you ever felt that when you listen to someone or when you read something, whether they are stating an opinion or is it a fact? Let me break this down. For instance, if you read something, water boils at 100 degrees Celsius. Now, that's a fact because it is scientifically proven. Something which is scientifically or something which is proven and has evidence, we call it as a fact. Now consider a statement. Summer is the best season, or I feel summer is the best season. So it's just my perspective. So it's an opinion. Maybe another person can feel winter is the best season. So if the idea varies, then it is an opinion. Then maybe like you might hear attitudes. For instance, a person can say, or an employee in an organization can say that, I think after the new manager has taken over charge, the company has a very refreshing atmosphere. But can that be proven or is it verifiable? No. It's just the attitude or an opinion made by one specific employee. But at the same time, like if I say that, as per statistics, after the new manager has taken over charge, the sales of the company has increased. So there is evidence for that. Then it becomes a fact. Now there can be judgmental statements. For instance, like a person can say that private hospitals are always better than government hospitals. But there might be another group who say that government hospitals are better. So that is also judgmental. It's one group's opinion that private hospitals are better, whereas another group feels that government hospitals are better. But there is no proof. But at the same time, if there is some recordical data to support the same, then it becomes a fact. So why did I bring up this topic? Now we're going to integrate this idea into OET Reading Part C, wherein you get a lot of questions which are opinion-based or attitude-based. So let's see how it works. Now that we have understood the basics of what a fact is, what an opinion or attitude or judgment is, let's see how we can apply the same when it comes to our reading section. Now you can see the slide on the screen. So as I have said, facts means they're just information which can be verified and it will have a neutral tone. It won't be biased. It will not have a positive or negative tone. It will have a neutral tone and it will be something that can be verified. That's information. No attitude, no emotion, and it will be unbiased. That is what we call as a fact. Now, here I have listed a few examples from our medical context or healthcare related examples wherein you can see facts. According to recent studies, vitamin D deficiency is common among older adults. According to the recent studies means it's proven or it is verifiable. So we consider it as a fact. Now the second one, clinical trials have shown means again it is proven that drugs reduces inflammation within 48 hours. So again it's a fact because we see the word shown here. Then the third example, it has been recorded that over 60% of nurses experience burnout during night shifts. It has been recorded means again it is a fact, something which has been verified and proven and it is recorded. Now the last example, research has established a clear link between prolonged screen time and disrupted sleep patterns in adolescents. Research has established means again it is verified and proven. So when you see such words or phrases in the statement, then you need to understand that it is a fact. It's not a judgment or an opinion or a thought by anyone, but it is something which can be verified. And for that reason, it needs to be considered as a fact. Let's look at a text and a multiple choice question associated with that. What does the question say? According to the extract, which of the following statement is a fact? Now they've listed out 4 different options. Out of these, which is a fact as per the text or as per the extract? Let's quickly go through the extract. Recent studies have shown that sleep deprivation negatively impacts cognitive function, particularly memory and attention. Recent studies have shown, which means that this is a fact. Now the next sentence, one study conducted at a US university found that means again this is a fact. What is the next fact? That participants who slept fewer than 5 hours a night performed 40% worse on memory tests than those who got a full 8 hours sleep. So we identified two facts. One is that sleep deprivation negatively affects or impacts cognitive function. The second fact is that participants who slept less than 5 hours a night performed 40% worse on memory tests than those who got a full 8 hours sleep. Then what is the next sentence? While some experts believe, now believe means we cannot consider it as a fact. It's just a thought or opinion of a person. So this is an opinion that a consistent sleep routine is more beneficial than longer hours. The debate continues in academic circles. So as per the third sentence, that is this idea, consistent sleep routine is more beneficial than longer hours. It's just an opinion. For that reason, we cannot consider it as a fact. Now that we have understood the extract, let's get into the options. The question is, which of the following statement is a fact according to the above extract? What does option A say? People should sleep at least 8 hours every night to stay healthy. Does it mention like that? Did you see any such reference in the extract? People should sleep at least 8 hours every night to stay healthy. No, it is not given at all in the passage or the extract, so that can be eliminated. Next option, option B. Academic experts agree that sleep deprivation is the main cause of poor memory. Agree that sleep deprivation is the main cause of poor memory. Is it mentioned? Of course, it is mentioned that sleep deprivation negatively impacts cognitive function, particularly memory and attention. But is it mentioned? Is it the main cause? No, not at all. So for that reason, it's not given. We can eliminate B as well. Moving on to next option, option C. A study showed that people sleeping under 5 hours performed worse on memory tests. This is given. A study showed that people sleeping under 5 hours performed worse on memory tests. This detail is actually given and it is we already identified it as a fact. So that can be the right answer. Let's look at the fourth option as well and then confirm. What does the fourth option say? A regular sleep routine is more beneficial than longer sleep hours. So that idea is given in the extract. It is mentioned that consistent sleep routine is more beneficial than longer hours. It is paraphrased into regular sleep routine is more beneficial than longer sleep hours. But what is the problem here? The question asks for a fact, and this, as per the text, this is an opinion. For that reason, we cannot consider D as well, which means that option C is the right answer. Hope that is clear. Now, let's move on to opinions, attitudes, judgmental words and all. Now, opinion words, the kind of words which you might notice in the text, and you have to understand that they are opinions, are when you see words like think, believe, suggest, claim, argue, recommend, propose, assume, feel, consider, point out, estimate, imply. All of these are opinionated words. They're not facts, but just what somebody feels about or somebody thinks about something. That is what you mean by opinion. So if you come across such words, you need to understand that they are just opinion and they are not facts. Let's look at a few examples. The specialist argues that early intervention is crucial for patient recovery. Argues. So there is no proof or evidence for that. The specialists say that this, or the specialist argue or claim that if there is an early intervention, then early intervention is actually necessary or important for patient recovery. So it is just a claim made by a specialist. We cannot take it as a fact because there is no proven evidence for the same. Then it is assumed that the new protocol will enhance treatment options. It's assumed. We feel that the new protocol will actually improve the treatment outcomes. This again is an opinion, not a fact. The researcher believes that a balanced diet reduces the risk of chronic diseases. Again, the word believes gives us the idea that it is an opinion. Some clinicians feel that the current guidelines are too restrictive. Feel. So feel, think, suggest, assume, believes, all these gives us an indication that it is an opinion. Now let's look at an extract and question and options. What is the question? What do clinicians opine about current chronic pain management? So what we need to find out is the clinician's opinion about the current chronic pain management. We have to read this short text and understand what is the opinion of the clinicians. What does the first line say? Many researchers argue that the current system for managing chronic pain is outdated and overly reliant on medication. Now, it's the opinion made by researchers, and here they are asked about the clinician's opinion. So for that reason, we can ignore this. Some clinicians believe that, okay, here believe that means it is of course an opinion, believe that a more holistic approach incorporating psychological support and lifestyle changes would yield better long-term results. So what is the opinion of the clinicians just regarding chronic pain management? They say that just medication alone is not sufficient. It should have a more holistic approach wherein the psychological aspects or the lifestyle should also be considered to get better long-term results. That is the opinion of the clinicians. Now let's go through the options. Option A says that as per option A, it means that clinicians opine that the current chronic pain management is suitable for most patients if medication is properly prescribed. Is such a statement regarding prescribing properly given in the extract? No, it's not given. So we can eliminate option A. Next, option B. It here refers to the current chronic pain management. Okay, it inadequately addresses the broader aspects of patients' well-being. It inadequately addresses the broader aspects of patients' well-being. Actually, in the extract, we can see the clinicians believe that there needs to be a more holistic approach. That is what they have paraphrased to broader. So that can be a probable answer. Let's put it on hold. Let's not decide or confirm. We need to go through the other options as well. Option C says that it is supported by most researchers and experts. Clinicians says that the current chronic pain management is supported by most researchers and experts. No, of course, it is not. In fact, the researchers do not agree with the current system of chronic pain management. Why? Because as per the first sentence, it says that many researchers argue that the current system for managing chronic pain is outdated, which means that they are not supporting the current chronic pain management system. For that reason, this is contradicting and we can actually eliminate option C as well. And moving on to the last option, option D. It has recently improved due to holistic approaches, which means that the current chronic pain management has recently improved. Has it improved yet? No, the clinicians just believe that if there is a holistic approach, it can yield better long-term results. It has not yet been put into action. For that reason, D can also be eliminated, which makes B the right option. Now, moving on, let's talk about hedging words. You might have noticed such words. Maybe you're not just familiar with this term, hedging words. Hedging words are nothing but when somebody states an opinion, to make it sound lighter or softer, they use words. These words are called hedging words. For example, words like may, might, would, possibly, probably, just to show an element of uncertainty. If somebody is stating an opinion and if they are not very sure about it, to express that uncertainty factor, we use certain words like these. Could, may, would, might, likely, seemingly, apparently, all these indicate uncertainty. So such words we call as hedging words. And you get these kind of words also in your reading part C. Let me show you a few examples. The new treatment may reduce recovery time in some patients. May means they're not very sure that it's going to reduce the recovery time. May. It shows uncertainty. It is likely that the recent policy changes will impact the staff morale. Likely. You're not certain. They're not certainly saying that the recent policy changes will impact the staff morale. No, it is likely. So there is an element of uncertainty there. You're not certain about it. Then there is a possibility that the symptoms are related to environmental factors. Again, there's a possibility, there's a chance, not certain. Patients appear to respond better to new medications. Appear, it is again same as seem. Patients seem to respond better to new medication. They just feel that, okay, they are responding better to the new medications, but there is no evidence. So they go for using the words appear or seem, just to show that we're not 100% certain about it. Now let's look at a question and options. What is the question here? What is the writer's main point about the new antiviral drug? What is the writer's main point about the new antiviral drug? Let's look at the extract. While early data suggests that the new antiviral drug might reduce the duration of flu symptoms, further large-scale trials are needed to confirm its effectiveness. So even though the early data gives an indication that the antiviral drug may reduce the duration of flu symptoms, actually the writer says that further trials are needed to confirm the effectiveness of antiviral drugs. Some researchers have noted that the drug's impact could vary depending on the patient's age and immune response. So in between, an idea has been placed which talks about some researchers, they have noted that the effectiveness of this drug vary depending on the patient's age and immune response. Then although the preliminary findings are promising, okay, the preliminary findings, they are promising, experts caution against drawing firm conclusions at this stage. So even though the initial findings regarding this antiviral drug seems to be positive or promising or encouraging, now we cannot draw a conclusion now without doing further investigations. So the writer's main point is that, okay, the antiviral drug seems to be promising, but we cannot conclude as of now without further investigations. That is the main idea. Let's see to which of the options we can match it up. Option A says that it has been proven effective in treating all cases of flu. No, it has been proven effective. No, it is not yet proven. So that is wrong. Option B, its benefits are well established across different age groups. No, what is said in the past extract, its benefits vary depending on the age group. But here it is said that its benefits, option B says that its benefits are well established across different age groups. No, for that reason, it's contradicting what is being said in the extract. So we can eliminate option B as well. Option C says that it shows early potential but more research is needed. It shows early potential. Early potential means it shows the possibility. It shows early potential. A possibility is seen. So it is same as promising. It shows that potential but more research is required. Here in this sentence also it is said that caution against drawing firm conclusions at this stage. Even though it is promising, in the first line also it is said that further trials are needed. So that can be the right answer. Let us keep it aside. What about option D? It will likely become the standard flu treatment soon. No such indication is given in the extract. It will become the standard flu treatment soon. No. So we can confidently say that option C is in fact the right answer. Here it is asking about the main idea or the main point of the writer. Okay. So we have to understand that extract completely and get the gist out of it. Now, attitude. Attitude is also similar to opinion. Attitude is more like feel, what a person feel like. Opinion can be thought of what a person thinks about something, and attitude is kind more of emotional. Like when somebody says unfortunately, surprisingly, worryingly, then overwhelming, frustrating, all these expresses attitude. This attitude and opinions can be used interchangeably, okay? Now let's look at a few examples. The results of the new treatment are encouraging, showing faster recovery in most patients. So this statement actually gives a positive feel. The writer indicates that he has a positive approach or a positive, encouraging attitude towards the new treatment. It's disappointing that the vaccine failed to produce long-term immunity in several trials. It's disappointing. That means the writer does not have a positive attitude towards this vaccine. Then the third one, worryingly, the number of antibiotic-resistant infection has doubled in the past decade. So worryingly, which means that the writer is concerned, has a worrying attitude, or definitely this is not positive one. The writer expresses his worry or concern regarding this idea. Then the next one, the surgeon's ability to perform such a complex procedure with ease is truly impressive. So the writer is impressed by this fact. So this is what you mean by attitude. Such words like encouraging, disappointing, worryingly, impressive, frustrating. Again, these words should be taken special care of because they indicate the attitude of the writer. Let's look at one question. What attitude does the writer express about the hospitals that neglect hygiene protocols? So what is the writer's attitude towards the hospitals that neglect hygiene protocols? Let's read this extract and find out. It's deeply concerning. So this in fact is an attitude. It's deeply concerning that some hospitals continue to overlook basic hygiene protocols. Okay, first itself the writer has stated that he is concerned regarding the hospitals that overlook hygiene protocols. Such negligence not only puts patients at risk but also reflects a worrying lack of accountability among healthcare administrators. And he has added on his idea by saying that this negligence on hygiene protocols, it puts patients at risk and also reflects, and another effect of that is that it reflects a worrying lack of accountability among healthcare professionals. It not just has risk for patients, but it reflects or it shows the lack of accountability, being responsible, the lack of responsibility among healthcare administrators. Now we understood that the writer's attitude is that he's concerned or he has a worry. He's worried regarding this situation. The question asks for that, what attitude does writer express about the hospitals that neglect hygiene protocols? Let's look through the options. Option A says that they are putting patients at risk due to limited resources. Of course, putting patients at risk has been mentioned in the extract, but what is actually which is not right here, due to limited resource. Did they mention about any limited resources in the extract? Of course not, so it's not given. It's wrong. Then option B says that their behavior raises concern about leadership responsibility. Now regarding lack of accountability, it's given in the extract, and of course the writer is concerned regarding that lack of accountability, which is nothing which can be actually paraphrased to leadership responsibility. So that can be a right option. Let's not conclude. Option C, their ongoing hygiene failures are understandable in a busy system, which means that the writer is supporting them, these hospitals who overlook hygiene protocols. The writer says that as per this option, it means that the writer says that it's because the healthcare professionals are really busy, they are not able to take care of the hygiene protocols. It is understandable. No, it's completely contradicting. The writer is really concerned about that. So we cannot choose this as the right answer. It's completely wrong. Then what about the last option? The writer emphasizes how hygiene protocols are often overlooked. How hygiene protocols are often overlooked. How it is overlooked, is it mentioned in the extract? No. He is just expressing his worry about the fact that some hospitals overlook the basic hygiene protocols. So for that reason, we cannot choose option D. And the writer is not trying to emphasize that idea. The writer is more than emphasis. What has more prominence here is that the writer's worrying or concerning attitude. For that reason, definitely option B is the right answer. Now, another aspect which we come across in reading part C not just reading part C, in part B also you get it, but in reading part C it's more evident, or you can see a lot of such words, the main clause and the subordinate clause usage. Now in a sentence, if it's a complex sentence, there can be a main clause and a subordinate clause. Main clause is something which can stand independently. Subordinate clause is something which requires the support of the main clause to complete the idea. Now in complex sentences, you'll have words like although, even though, while, whereas, despite, since, in spite of. All these words will be present in a complex sentence. Now let's look at a few examples. Although the treatment is effective, it is not widely available in rural areas. So now this, it is not widely available in rural areas. This is the main clause. Although the treatment is effective, this is the subordinate clause. This subordinate clause cannot stand independently. Although the treatment is effective, no, the idea is not complete. But if you look at the second part, it is not widely accepted, it's not widely available in rural areas. It's a complete idea. So we call this as the main clause and the other one as the subordinate clause, main clause and subordinate clause. Now why did I bring up this idea? Now you can see such sentence constructions in your reading text. These are just, these are just distractors. The idea given in the subordinate clause are just distractors to mislead you or misguide you from the right answer. Here the statement says that although the treatment is effective, it is not widely available in rural areas. So the focus is on the lack of availability of the treatment in rural areas. You understand that although the treatment is effective, okay, that's just to misguide you. They've said that okay, it is effective, but it's not widely available in rural areas. Now the next example, even though the symptoms had reduced, the patient was kept under observation. So the main idea is that the patient was kept under observation. Now you can see a couple of other examples also using while and despite. So you have to read carefully. You read the statement twice before concluding an answer. When you're reading a statement which contains this main clause and subordinate clause, that if it's a complex sentence involving connectors like this, although, even though, despite, in spite of, since, if and all. Okay, let's look at an example. The question is, what is Dr. Bennett's view of the new staffing model? What is Dr. Bennett's view of the new staffing model? It's a very short extract. Although the new staffing model was initially met with hesitation, so although initially it was met with hesitation, Dr. Bennett argues that it has ultimately led to improved patient outcomes and a more efficient workflow. So initially they have said a negative aspect, that is they have talked about the hesitation. But what does Dr. Bennett say? That even though initially it was met with hesitation, that's a negative aspect, the part that follows this is a positive thing. Ultimately, it has led to improved patient outcomes and more efficient workflow. So the word hesitation is just given to distract you. Despite the fact that there was an initial hesitation, ultimately what has happened, this new staffing model has improved patient outcomes and a more efficient workflow. Let's look at the options and figure out the right answer. The question is, what is Dr. Bennett's view of the new staffing model? Option A says that it is not widely accepted. No, of course not, because Dr. Bennett argues that despite the initial hesitation, now it has improved patient outcomes and it has more efficient workflow. Nothing is mentioned about the acceptance, so it's wrong. Option B says it has not been effective in improving outcomes. No, it is completely a contrast of what is given in the passage. So that is also wrong. Option C, it has made hospital operations more efficient. Yes, of course it has done. That is what we see here. It has ultimately led to improved patient outcomes and more efficient workflow. So that is the right answer. Even then, let's go through option D as well. Option D says that it remains a controversial approach among staff. Now, no controversy has been mentioned in the extract, so for that reason, we have eliminated option D as well. Therefore, concluding that option C is the right answer. With that, we have come to the end of this video. I hope that you will incorporate the ideas which we have discussed now next time when you do your reading part C, and let us know how effective it was. Stay tuned for more videos. Thank you.
Medcity International Academy. Trusted hands forever.